Well, the FDA has approved the first vaccine to protect infants against RSV.
It would be given during a woman's pregnancy so the antibodies could be passed on to newborns. The maternal vaccine would be given between 32 and 36 weeks of pregnancy and protect newborns for 6 months. A clinical trial at Cincinnati Children's Hospital involved more than 7,000 pregnant people. The CDC says more than 2 million children under the age of 5 get RSV each year. Up to 80,000 are hospitalized and 300 die. In addition to protecting babies, this new RSV vaccine may provide moms peace of mind.
It means that we have yet another tool to help keep babies safe and healthy, especially during that first year of life where they are so fragile and so vulnerable to so many viruses.
Last RSV season was longer and more severe than usual, overwhelming hospitals in many places across the country. The vaccine expected to be available by fall. Dr. Pothof is joining us now for his weekly visit, and you're shaking your head during that story. This works.
Yeah, I mean, if you remember last year, we had a pretty bad RSV season. It's particularly dangerous for the very young, those infants, and the old. And now we've got two things for these really young patients. One, there's this vaccine that a mother takes before she delivers. That immunity passes from the mother to that baby. They're protected that way. There's also recently approved and now endorsed by the American Academy of Pediatrics an antibody, an injection that young babies can get that reduces their likelihood of hospitalizations from RSV by 75%. So, so much has changed in the RSV world in the last year, and for the better.
Yeah. And for older folks, too.
Yeah, for older folks, those over the age of 60, there's now a vaccine that'll be available. May not be on the shelves yet, but certainly talk to your primary care providers if you're in that age group and ask about this. I think for this fall, especially those over age 60, they're going to be looking at a new COVID booster, a flu shot, and an RSV vaccine.
A pincushion.
Yeah. Get ready, it's that time of year. The other thing that we've been talking about, reminding people about the heat. And I think it's really easy to underestimate how dangerous it can be.
I think so. I think, you know, every once in a while we talk about the heat, and I think, and I kind of do this, you kind of throw it off. You're like, yeah, it's going to be hot, but like whatever, I'm kind of doing what I want to do. For the next few days, like that's probably not the best approach. You really do want to be prepared for the heat. So, you know, make sure you have a place to cool down, especially if you have to spend any amount of time outside. And then, you know, do smart things like, you know, loose fitting clothing. Make sure you got plenty of water or Gatorade sports solutions, things like that. And then if you have, you know, comorbid medical conditions, you're older or you're the extremes of age, very young, more susceptible, be extra careful about what you're doing the next couple days.
What are the warning signs?
So early on, when you have heat exhaustion, you're going to have lightheadedness, you're going to feel a little dizzy, maybe you have some nausea, slight headache. Those are those early warning signs. You want to get out of the heat when you feel that.
And you sweat a lot.
Yeah, you'll sweat a lot. And then as you get hotter and hotter, your body can't compensate anymore. You'll stop sweating. Your temperature will go above 104 degrees and you'll start to get altered. You won't make sense. Your friends will feel like you're slurring your words. That's really dangerous. That's, you know, when you don't try to fix it yourself, then you got to get to a hospital.
Yeah. And I think it's also a good time to remind people, if you have kids or pets, that car can get really, really hot really fast.
Absolutely. I mean, sometimes we cheat. We run into the store, something like that real quick. That is not the thing to do over the next couple of days. Those cars are going to be ovens. Make sure no one's in there.
Yeah, and the heat of the day, blacktop can burn your feet.
Yeah, absolutely. We've seen stories of this, or we've seen it where, you know, you're just going to run barefoot down the driveway, get the mail or something.
Ouch.
Doesn't work on days like tomorrow and then the next day. It's just too hot.
Pet's paws, too. Keep
Pet's
that
paws,
in mind.
absolutely.
All right, let's talk about COVID. There's a new variant out there.
There is. This one's a little bit more interesting than a lot of the variants that's come over the last year. This one, I think, is XB 2.8 or BA 2.86. And what's so different about it is it's not Omicron based. For the last year, it's been all Omicron or, you know, subvariants of Omicron. This one has 36 different mutations. It's not at all like Omicron. But with that said, we're just not sure how much this is going to turn into anything. A couple cases have been found. It's in 4 different countries. It's worrisome that it has all these mutations, but we're not sure that it's going to be more transmissible. We're not necessarily sure that it's going to cause more severe disease. It probably will be better about evading immunity because our vaccines are more focused on Omicron, not this new variant.
And is it still worth noting, I mean, we're not back in 2020. We have these developments that are behind us.
Yeah, absolutely. I mean, at this point, everyone probably has some degree of protection against COVID-19. So even if this does start to gain some traction, we are not going back to a new pandemic. That won't happen.
And the new vaccine should be available
September, October should be pretty soon.
So get it.
Yeah, get it for sure.
And it's aimed for Omicron.
It's aimed for Omicron, and that is what's most common right now. So the vaccine that will be available this fall is a good match. We'll just have to see if this other variant, that's relatively new, not very many cases, starts to increase in numbers.
Stay cool, everybody.
Agree.
All right, doctor, thank you.
Thank you.